The complexity of vaccinating 19 million South Africans in rural areas will remain a challenge for the country's health department. The biggest challenge is ensuring that vaccines make their way from vaccine sites into the arms of recipients, known as a last mile, which is commonly the hardest to get right. Joining us to explain how South Africa can use its successful history of vaccinations to deliver rural vaccinations is CEO of South African Internet of Things company Beyond, Ian Lester. Ian, very good afternoon. Is it as complex as we say it is?
Good afternoon, Hugo. It actually is. It's the cold chain is. We often just think of cold chain as maintaining temperature, but when one understands the length and breadth of the cold chain in order to get vaccines from manufacturers, as you said earlier, into the veins of people, it is an extremely complex and very wide-reaching network of equipment, people, facilities, spanning the length and breadth of the country. So it's actually an incredibly complex thing to get right.
So what's currently being done, or what can we do to get this right?
Well, I think, a lot of, as you know, the country up until this point, we've really been doing without undermining the complexity of what we've done thus far, we've really been doing the easy part, which is, getting to people in major urban centers. Obviously, healthcare workers have been the first recipients, and it is the nature of their job to arrive at healthcare facilities. So, when we start to understand or think about the complexity of getting into that last mile, I think the important thing to get right now is start to truthfully plan for it and making sure that we have the right equipment, people, resources on the ground that will be ready to receive these vaccines when we eventually get to that last mile. So I think it's important that while we are doing the early stages of this vaccine rollout, that we truthfully consider the hardest part, which is getting into rural communities where infrastructure, power, people are often or skilled people at least, are often in short supply. So I think the big issue right now is to get the planning right.
Now, obviously, I'd like to imagine that support or resources for the rural community might be skewed away from them, considering that 19 million South Africans live in rural South Africa. There's almost 30% of those which we need to vaccinate, or at least 30% of the population.
Correct, and I think therein lies the biggest, the reality check is that, when we look at what the head of the WHO said recently, and it's a mantra that gets repeated over and over again, which is unless the last person is vaccinated, none of us are safe. And I think it really boils down to the reality that we're facing variants that emerge virtually on a daily basis, and all variants need is unvaccinated people and time. So those people living in these remote communities, it's critical that we get to them, because while we're vaccinating people in urban environments, the longer it takes to get to those people who are in rural and remote communities, the more variants will appear. And those variants, quite obviously, are a risk to those who've already been vaccinated, because we're not sure whether or not the variants or the vaccines are going to be effective or as effective against the variants. So I think it's a combination of, as I said, the remoteness of these communities, the importance of getting to them, and the fact that in our country particularly, a third of our population, almost a third of our population, lives in those communities. So it is logical that they will be lost simply by virtue of the nature of the way the supply chain is going to be rolled out. But the fact that they're going to be lost doesn't mean that they're unimportant. I think they are equally important, and the clock is literally ticking on making sure we can get to them.
Now, one of the things that the internet has been able to do is allow us to see what everyone else is doing across the globe. We know that the US, whilst it's a lot more advanced than we are, has vaccinated millions of its citizens, both rural and urban. Can you just give us some insight into certainly what those challenges are and what government needs to be doing now in order to be able to reach people in the rural parts of South Africa?
Well, I guess the best way for me to answer that is to paint the picture. If you consider in South Africa that these vaccines come into the country, they land up at centralized depots where they get stored in bulk. They then go from there into regional depots, and from those regional depots they go into clinics, and from those clinics they go out into what we call the last mile sort of outreach programs, where we have to take vaccines to people. So you literally go from one large national facility to thousands or tens of thousands of outreach points. And the challenges there really relate to a couple of things. Number one is equipment. You have to have cold chain equipment at scale, literally in the tens of thousands of refrigerators and these aren't just regular refrigerators. Domestic equipment is not ideal. It can be used. It's a lot more difficult to use this in terms of domestic refrigeration to get this job done. But in terms of medical grade refrigeration, there is currently a global shortage of medical grade refrigeration. So number one, we need the refrigeration. Number two, we need the skills and the resources and the people who are qualified and certified to administer those vaccines. And then, of course, the obvious challenges which we've been facing for many years is refrigerators, by their nature, need power. And we know we're living in a country where we are power constrained. So that brings into play the issues of having generators and fuel to power those generators. So when one understands the complexity of all these moving parts that have to move in unison to make a cold chain work, to make sure that that jab can get into somebody's arm, there are so many things that need to be thought of. And I think the key message for us, and we wrote an article about a year ago talking about the fact that when we were waiting for the vaccine, that it is important to start planning way in advance of the arrival of vaccines in those areas. So I think the key message from our side is the importance of planning and making sure that when we eventually get to that part of the process of vaccinating the people in the last mile, that the people, the equipment, and the power has been taken care of. Because without those things, well, frankly, you can't actually get the job done.
Ian, has there been an engagement between you and the Department of Health regarding this?
Well, we're obviously we're part of that process, and we do engage with them from time to time. Our primary engagement at this stage is largely in the private sector, so we're working very closely with Dis-Chem Pharmacy, who've been a client of ours for many years, as well as more recently with Discovery Health in their rollout. So there are several organizations who are key to this process. Obviously, the government is the biggest and the bulk in terms of the rollout. But I think there's also a lot of work being done by the private sector, including, interestingly enough, the mining sector, who, as and when their turn comes, will also be vaccinating their miners as well as people around those communities or around those mines. So I think everybody accepts that this is going to be a collaborative effort by both government and the private sector to ultimately get this job done. And I think we will get it done, but we can never take our foot off the gas to make sure that we need to fully understand the complexity of making this work and making it work consistently.
So let's talk about the private sector. Obviously, very interested in what you've raised there, which is how mines, for instance, and obviously their desire to then vaccinate some of those individuals who live in mining towns. What are some of the processes that they've gone through? And do you see government engaging private sector in those areas where they cannot reach or do not have certainly the means to provide refrigeration equipment, for instance?
Yeah. So I think certainly from not just mining but all sectors, I think everybody has an incentive to get this process done as quickly as possible, so we can get back to business as usual, or as close to business as usual as we can get, because the old cliche, which has now become a cliche, we've got to save lives and livelihoods. So I think industry, broadly speaking, is going to be actively involved in assisting government and working very closely with government in getting this done. As to what engagements are happening, I certainly know that government is working literally every single day with the private sector on getting this job done, and I think that will continue to happen. I think we've all realized that this is a job that cannot be left to one or other party. It's really the responsibility of everybody, both private and government sector, to collaborate to get this done as quickly as we possibly can.
Now, herd immunity is obviously what everybody's trying to get to. Do you suspect that maybe government is looking to herd immunity and not necessarily focusing on the 19 million in rural areas?
I mean, I have no doubt that the government fully understand the full extent of what needs to be done. I think it would be foolhardy of anybody to rely on herd immunity, and certainly everything we've heard from the government on this, and you have as well, is that it is about getting this vaccination program done, getting it done as quickly and as efficiently as possible. So I certainly, and I can't comment for government, it's not my place, but I think having the engagements we have had, everybody fully understands the complexity and enormity of this challenge and are fully cognizant of what needs to be done. But the mountain to climb is very tall, and I think it's going to take some time.
Finally, Ian, before we let you go, obviously vaccination have been occurring in South Africa, every single day. Young people, children are vaccinated as soon as they are born. Will this add any support to the vaccination process?
Absolutely, and I think that is the silver lining on this very dark cloud, I guess, is that, you know, vaccination, or what we can refer to as routine vaccination, is something has been really the bedrock of healthcare around the world for years. You know, if you can prevent diseases, it's far better than trying to cure them. So I think the silver lining is that the work and the effort that has been put in place today to support the COVID rollout, that infrastructure and know-how and resource will ultimately help and assist future rollouts of routine vaccination. And just one example, which I think is an interesting one, is, you know, when one considers, you know, other diseases like measles, pneumococcal disease, and, you know, all these other hepatitis and so on, all of which are vaccine preventable diseases, they in themselves have had challenges around cold chain for many, many years. So I think the focus that has been put on the supply chain and the cold chain in particular as a result of COVID, once, and pray God we are through this epidemic or pandemic, that infrastructure will remain, and that will only be a good thing for routine immunization, which is something that we obviously need to continue. And I think another important point is everybody is fully cognizant of the fact that the COVID vaccine has to a large extent distracted many organizations and countries from routine immunization. And when I say not distracted, not deliberately, but just purely out of necessity. So I think what everybody is looking forward to is to build the capacity necessary to carry the COVID vaccine, but at the same time allowing us to continue with routine immunization to prevent all of these other terrible diseases that I mentioned, some like measles, you know, to make sure that we don't, while we're solving the COVID problem, we don't inadvertently create another pandemic or epidemic around things like measles and other diseases which are vaccine preventable.
Ian Lester is the CEO of South African Internet of Things company Beyond. Thanks for your time this afternoon.